Hi, my name is Dr. Yash Sharma. I'm currently a second-year resident at the University of Pacific Arthur A. Dugoni School of Dentistry, and I'm part of their graduate orthodontics program. I would like to first thank Dr. Kika Masunaga for completing this case, as well as Dr. Noor Majub, Dr. Andrew Levin, Dr. Ali Gauzi, and Dr. Eric Lay for also helping with her treatment. Also, I'd like to give a big thanks to Dr. Steve Dugoni, Dr. Jetson Lee, and Dr. Adrian Joy for their hard work and dedication to this case and giving us such great guidance. Patient Annie presented to our clinic at 8 years old and 1 month. After a referral from her general dentist and the cleft lip and palate panel at the Children's Hospital of Oakland for her orthodontic management of her left unilateral cleft lip and palate. She presented with a straight profile and adequate malar support, despite minimal upper lip support due to an underlying maxillary deficiency. From the frontal aspect, her face displayed a slight asymmetry due to her past lip repair, with a slanting down of the alar base and a narrowed lip commissure on the left side. In terms of her upper and lower midlines, they were coincident with her facial midline, but you'll see in the intraoral photos she had a 2 mm diastema between her upper ones. Here are her initial intraoral photographs. She was in the early mixed dentition phase when she first presented. She had an upper tapered arch form and a lower broad-shaped huge arch form. This tapered arch form is most commonly seen in cleft lip and palate patients. And in terms of her dentition, she had upper right 1 and upper 6s present. In terms of her lower permanent dentition, she had lower 1s, 2s, and 6s present. She had C's, D's, and E's in all quadrants, as well as upper left A and B retained. Here we can appreciate her initial models in terms of her bilateral class 1 molar relationship with posterior and anterior crossbite. In terms of her overjet and overbite, they were edge to edge at 0 millimeters, and you can really appreciate the lower mild crowding. And when we do the space analysis and when you see the panoramic x-ray, there was moderate spacing on the upper. Here's her initial panoramic radiograph. You can see that the sinuses are well pneumatized, the TMJs are well seated with diffuse cortical outlines according to the TMJ slices, which were consistent with her age. There is a gross symmetry of her mandible with adequate alveolar bone levels except for the upper left alveolar cleft site between upper left 1 and 2. All 3s through 5s and 7s were developing well, with upper left 1 ectopically positioned with the crown pointing approximately 150 degrees towards the superior aspect of the palate. The maxillary laterals were hypoplastic, with the crown side of the maxillary left lateral incisor being especially small. Here's her initial lateral ceph measurements. She is bimax retrusive with an A and B of 1 and a width of -5.3, which indicates a class 3 skeletal pattern. She is normodivergent towards a hyperdivergent skeletal pattern with an FMA of 27.9. In terms of her lower anterior facial height, it's mildly short at 96.4. In terms of her interincisal angle, it was obtuse. That's primarily due to the mildly retroclined maxillary right central incisor and the mandibular incisors. In terms of her CVM maturation, her growth potential was estimated to be a stage of CVM 2 to 3 at this time. These are the 4 treatment options given to the patient and her father. The patient and her father first elected for treatment option 1, but it was later changed to treatment option 4, in which phase 1 turned into 1 full comprehensive phase of treatment. This is how the patient finished at 14 years and 11 months after 5 to 6 years of treatment. In terms of her retention, she had a fixed retainer from her upper right 2 to upper left 1, and she had an overlay Hawley. In terms of her mandibular dentition, she had a mandibular Hawley as well. Currently, she's planning on getting a alveolar bone graft between upper left 1 and 2 alveolar cleft site, and after that, she'll get definitive restorations on upper left 1, 2, and 3 from a restorative dentist. The patient and her father are super satisfied with the result, and thank you for tuning in today. And for more details on this case, please join the PCSO Bulletin 2024 spring issue. Thank you.